Welcome to Path to Nursing. Test your knowledge with 10 original NCLEX Obstetrics questions. Pause the video, choose your answer, then listen to the rationale. Let's begin. Question 11. A nurse is assessing a postpartum client. Which finding requires immediate intervention? A. Fundus firm and midline. B. Lochia rubra with a few small clots. C. Saturating one perineal pad in 15 minutes. D. Mild uterine cramping during breastfeeding. Correct answer, C. Saturating one perineal pad in 15 minutes. Rationale: soaking a perineal pad in 15 minutes suggests excessive bleeding and possible postpartum hemorrhage. This requires immediate assessment and intervention. Question 12. Which nursing intervention should be performed first for a client experiencing uterine atony? A. Massage the uterine fundus. B. Administer antibiotics. C. Place the client in Trendelenburg position. D. Encourage oral fluids. Correct answer, A. Massage the uterine fundus. Rationale: uterine massage stimulates contractions and is the first nursing intervention for uterine atony. Question 13. A postpartum client has a boggy uterus. What is the most likely cause? A. Bladder distension. B. Hypertension. C. Fever. D. Breastfeeding. Correct answer, A. Bladder distension. Rationale: a full bladder can displace the uterus and prevent effective contraction, resulting in a boggy uterus and increased bleeding. Question 14. Which medication is commonly administered first to treat postpartum hemorrhage caused by uterine atony? A. Oxytocin. B. Magnesium sulfate. C. Terbutaline. D. Betamethasone. Correct answer, A. Oxytocin. Rationale: oxytocin is the first-line uterotonic medication used to promote uterine contractions and reduce postpartum bleeding. Question 15. Which client has the greatest risk for postpartum hemorrhage? A. Client with prolonged labor. B. Client with a normal spontaneous vaginal birth. C. Client who breastfeeds immediately after birth. D. Client with a newborn weighing 2.8 kilograms. Correct answer, A. Client with prolonged labor. Rationale: prolonged labor can fatigue the uterine muscles, increasing the risk of uterine atony and postpartum hemorrhage. Question 16. The nurse notes that a postpartum client's uterus is displaced to the right. What is the nurse's priority action? A. Assist the client to empty her bladder. B. Massage the fundus vigorously. C. Notify the healthcare provider immediately. D. Encourage increased fluid intake. Correct answer, A. Assist the client to empty her bladder. Rationale: a full bladder can push the uterus to one side and interfere with uterine contraction. Emptying the bladder often allows the uterus to return to the midline and contract effectively. Question 17. A postpartum client has a boggy uterus that becomes firm after fundal massage. What should the nurse do next? A. Encourage the client to empty her bladder. B. Administer magnesium sulfate. C. Place the client in Trendelenburg position. D. Apply an ice pack to the perineum. Correct answer, A. Encourage the client to empty her bladder. Rationale: a full bladder can prevent the uterus from contracting effectively. After the uterus firms with massage, emptying the bladder helps maintain uterine tone and reduce bleeding. Question 18. Which postpartum client should the nurse assess first? A. A client with a firm uterus and scant lochia. B. A client saturating one perineal pad every 15 minutes. C. A client breastfeeding with mild uterine cramping. D. A client with a temperature of 37.2 degrees Celsius 99 degrees Fahrenheit. Correct answer, B. A client saturating one perineal pad every 15 minutes. Rationale: rapidly soaking a perineal pad indicates severe postpartum bleeding and requires immediate assessment and intervention. Question 19. The nurse is caring for a client with postpartum hemorrhage. Which laboratory value is most important to monitor? A. Hemoglobin and hematocrit. B. Sodium. C. Potassium. D. Calcium. Correct answer, A. Hemoglobin and hematocrit. Rationale. Hemoglobin and hematocrit help assess the degree of blood loss and guide treatment decisions, including whether a blood transfusion may be needed. Question 20. Which assessment finding suggests that treatment for postpartum hemorrhage has been effective? A. The uterus is firm and bleeding has decreased. B. The client reports increased thirst. C. The client's heart rate increases to 120 beats/min. D. The fundus remains boggy. Correct answer, A. The uterus is firm and bleeding has decreased. Rationale. A firm uterus with reduced vaginal bleeding indicates that uterine contractions have improved and the hemorrhage is being controlled. Question 21. Which factor places a postpartum client at increased risk for uterine atony? A. Prolonged labor. B. An empty bladder. C. Early breastfeeding. D. A normal-sized infant. Correct answer, A. Prolonged labor. Rationale. Prolonged labor can exhaust the uterine muscles, making them less able to contract effectively after delivery, increasing the risk of uterine atony. Question 22. A nurse is caring for a client with postpartum hemorrhage. Which nursing action has the highest priority? A. Continue to monitor the client's pain level. B. Massage the fundus and notify the healthcare provider while initiating emergency interventions. C. Encourage the client to eat a high-protein meal. D. Delay interventions until laboratory results are available. Correct answer, B. Massage the fundus and notify the healthcare provider while initiating emergency interventions. Rationale. Postpartum hemorrhage is an obstetric emergency. Immediate nursing actions include promoting uterine contraction, notifying the healthcare provider, monitoring vital signs, establishing or maintain. Great job completing today's NCLEX practice. How many questions did you answer correctly? Let me know your score in the comments below. I'd love to hear how you did. If you found this video helpful, please like, subscribe, and share it with a friend who's also preparing for the NCLEX. Remember, every question you practice brings you one step closer to becoming a confident and successful nurse. Thank you for watching, and I'll see you in the next NCLEX practice session. Until next time, keep learning, keep practicing, and stay on your path to nursing.